Hello, this is alternate nostril breathing, a little video guide from Synthesis Medicine Acupuncture. Although this is actually from Ayurveda. So I do lots of Ayurveda in my practice, diet, lifestyle, breathing, Kala Chikitsa time therapy, which is doing things at the most beneficial time of day or time of year. Time is very important. Anyway, the best time of day, start there, for Nadi Shodana or alternate nostril breathing is either first thing in the morning, really gives you a nice, calm baseline to begin your day from. Or for folks with a little insomnia, wonderful before bed. I like to do it laying in bed already, get cozy. Don't do this, get nice and calm, and then get up and brush your teeth and wash your face, and then get in bed, check your phone. Just last thing right before allowing yourself to drift off. This is perfect. Also, it's wonderful right before anything potentially stressful, or anything that you need a really nice, clear mind for. For example, I do this 3 or 6 or 9 rounds before each patient. A few more if I have rushed from my car. Um, Sitting in traffic, you know, when things go awry. This is a really nice way to reset. Some benefits are we are going back and forth. You'll see this. So we're connecting both hemispheres of the brain. So everything comes online, and that helps you to be very present in the current moment of what is. This isn't a zone out. This is a coming to the present moment. We also expand our lungs completely, which will give the organs a little nice massage, a little more space, stretches the intercostal muscles. Those are the muscles that are between each rib. They get very, very tight, especially if we're stressed out. Everything locks up and in, right? So the lungs, the way to let them go is really, and let the blood flow get back to the intercostals, is to breathe. We forget that breathing, this expansion, is actually stretching those muscles manually. What else does it do? It allows for a clear mind, moves our nervous system from a fight or flight state to a rest and digest state. That's also known as the parasympathetic nervous system. This allows for digestion, regeneration of tissue, all the things that get put on hold when our body is stressed. Our body doesn't know the difference between a physical threat and an emotional or mental threat. So we react as though there is a bear chasing us, from the woods. So, well, maybe here in Asheville, that's actually happened to you. Probably not, but you may have seen them there. They're very cute. But that is, of course, a side note. The point is, in the fight or flight state, our blood flow moves from the center of the body, the trunk where all of our organs are, into the large muscles, into the extremities, so that you literally have oxygenated blood available to run away, fight, or, basically get the heck out of there. Another layer that can happen is freeze, which this physiological expression of that is a little different. However, our organs do also have that same reaction where they're not going to get the blood flow, and everything stops. So this is not just a great way to calm down when you're activated, but to come back from a freeze state when you are paralyzed when you're stuck or slightly dissociated or something like that. Although, please speak to your therapist. I am not a therapist. So note that if you're having a true dissociative attacks and PTSD flashbacks, this is something to talk to your therapist about, as if it's an appropriate choice for you. And if we're talking about just stress and that sort of when things are overwhelming, like, oh God, I've got 20 things to do and everyone's asked me a question and then my brain has gone offline. This happens to me a lot. Then alternate nostril breathing will bring that clear thinking back. It's like a mini freeze state. So let's go. So first thing we're going to do is always take 3 nice, long, slow breaths through both nostrils to get going. Here we go. We'll do it together. Let's do 3. So please notice, yoga folks, I'm not doing a constriction. I'm not doing a ujjayi constriction in the throat. I want everything to loosen up. I'm not trying really hard to control how fast or slow this air is coming in or out. I'm allowing it by letting go of all of my control over it to do its own thing. It may slow down on its own, but I am not measuring that. And there's reasons for that. I'm also not counting. Some people do great with counting. Some people, it makes them more stressed out. I tell my patients I have like a tendency to perfectionism. So if, say, I am not going to make that 8 count, I feel like I did it wrong and I get stressed out, which is not the point. So you know yourself, pay attention to yourself. If counting really helps you to slow the breathing down, become more conscious, go, oh, I'm really racing through this. I've got to slow it down and count slowly. Wonderful. If that is something that puts you into a little bit of a racy state, lose it. This is everyone is so unique and we react so differently to these different things. And that's really important to pay attention to because the point here is to get to a calm place. So after 3 nice, long, slow breaths, you can close your eyes. You don't have to. Whatever works for you is beautiful. Oh, and I forgot to say sitting. Right now I'm sitting straight up. But if this was to bother my neck, and some days it would, or low back, I would prefer to choose a chair where I could recline and lean back and make sure my whole spine is supported so I can be comfortable. It's very difficult, as we all know, to relax when we're uncomfortable. So make your body comfortable. If that's laying down, beautiful. If you're laying down and your low back hurts, then put a pillow under your knees, or you can bend your knees and put your both soles of the feet flat on the bed or the floor or the couch and allow your knees to like rest together. This takes all the work out of your hip muscles when you're laying on the floor or on the bed. If the floor is too hard or if it's difficult to get down or up from the floor, lay on the bed or the couch. Okay, we're talking about ease. Okay, so we did our 3 breaths. I'm going to close the right nostril. Doesn't matter what hand you use, but you do always want to start by closing the right nostril and inhaling through the left. The top of the inhale, close the left nostril, and then exhale through the right. At the bottom of the exhale, inhale through the right. At the top of the inhale, switch, exhale through the left nostril. Inhale through the left. Switch to the right. Exhale. Stay on the right. Inhale. Exhale through the left. This is slowing down on its own. Inhale through the left. Exhale through the right. Inhale through the right. Exhale through the left. Inhale through the left. Exhale through the right. Inhale through the right. And exhale through the left. Always inhale. Always make your first inhale on the left and your last exhale on the left. Take 3 wrap-up breaths with both nostrils. Okay. So how do I know I've done enough? 1, my voice has dropped in pitch, maybe a little less than normal because I talked through the whole thing to explain it. My voice will drop in pitch, a higher pitch down to a lower pitch. My voice will slow down. This is just happening. I'm not trying. My shoulders might feel a little more relaxed. My chest usually feels a little more open and spacious. And the big one for me, I'm able to think more clearly and have a more organized, easy thoughts with space around them. So that's the goal. So some beautiful effects of this is you get good at it. If you do this every day, once a day, twice a day, you get good at it. And your body will remember after just 1 or 2 breaths. So say you have been practicing for maybe 2 weeks, once a day for 2 weeks, 9 breaths. So that takes what? 2 minutes. And you are noticing, I'm waiting in line at the grocery store and I'm really irritated. This is taking too long. I gotta be somewhere, but there's nothing you can do about it, right? You can take 2 sneaky breaths and you don't even have to use your hand, right? You can just imagine that air coming in through the left and out through the right. In through the left, out through the right. In line at the grocery store. My teacher, one of my teachers, Claudia Welch, I got this from her. Many of us got that little trick from her. You don't need to use your hand. Once you have a reference for that sensation of nervous system dropping from a, high stressed place to more quiet, you can just flick that switch yourself. Another thing is, yeah, if you're getting good at it, right? So you don't need all 9 breaths necessarily every day. Or in the middle of the day, in the middle of something, you can just do a really abbreviated reset and it will work. So I do 3 before each patient, just 3. Takes like less than 1 minute and changes the way that I'm able to engage present in the present moment with my patients right away. Any other tricks I could share about this? Oh yeah, even if say you're trying to go to sleep, okay, you can, and the hand thing keeps you awake. So you start with 9 like this, and then you are laying on your back, and then you're like, gosh, I really wish I could get more comfortable. What's the position you fall asleep in? If it's on your side, get on your side. And say I'm laying on this side, and I use my right hand, or maybe my left hand even because it's like closer to the bed. And eventually, after maybe 3 more, 5 more, I drop my hand down and just keep imagining that breathing without my hand and drift right off. So, okay, I hope this is really helpful. And I'd love to know how your practicing is going and if it's helping. And if it's not helping, tell me, because we could tweak it for you, because everyone is indeed quite different. Thank you.